Hello, everyone. It's Wednesday, February the 9th, and I guess before we go any further, we've lost another 62 people in West Virginia, and I ask for your prayers. I ask for your respect as I read through all these people and everything. Please share all your prayers and all your respect. The 5,878th death in West Virginia is a 78-year-old male from Kanawha County. The 5,879th death, an 85-year-old female from Wayne County. The 5,880th death, a 64-year-old female from Raleigh County. The 5,881st death, an 85-year-old female from Berkeley County. The 5,882nd death, a 56-year-old male from Preston County. The 5,883rd death, a 78-year-old male from Kanawha County. The 5,884th death, a 69-year-old female from Monongahela County. The 5,885th death, a 67-year-old female from Clay County. The 5,886th death is an 86-year-old male from Putnam County. The 5,887th death, a 77-year-old female from Barber County. The 5,888th death, a 78-year-old female from Kanawha County. The 5,889th death, an 86-year-old male from Hardy County. The 5,890th death, a 66-year-old female from Lincoln County. The 5,891st death, an 81-year-old male from Kanawha County. The 5,892nd death, a 92-year-old female from Cabell County. The 5,893rd death, a 67-year-old male from Harrison County. The 5,894th death, a 66-year-old female from Ohio County. The 5,895th death, a 73-year-old female from Wyoming County. The 5,896th death is a 77-year-old female from Roane County. The 5,897th death, a 74-year-old female from Logan County. The 5,898th death, an 83-year-old female from Wyoming County. The 5,899th death, a 76-year-old male from Summers County. The 5,900th death in West Virginia is an 87-year-old female from Nicholas County. The 5,901st death is a 66-year-old male from Wood County. The 5,902nd death is a 68-year-old male from Cabell County. The 5,903rd death is a 99-year-old male from Barber County. The 5,904th death is an 82-year-old male from Harrison County. The 5,905th death is a 66-year-old female from Mason County. The 5,906th death is a 94-year-old male from Kanawha County. The 5,907th death is a 51-year-old female from Harrison County. The 5,908th death is a 52-year-old male from Wood County. The 5,909th death is a 66-year-old female from Kanawha County. The 5,910th death is a 91-year-old female from Wood County. The 5,911th death is a 70-year-old female from Monongahela County. The 5,912th death is a 68-year-old male from Jefferson County. The 5,913th death, an 87-year-old female from Kanawha County. The 5,914th death is a 90-year-old male from Nicholas County. The 5,915th death is an 87-year-old female from Wirt County. The 5,916th death, is shame, is a 43-year-old female from Kanawha County. The 5,917th death, a 93-year-old male from Wetzel County. The 5,918th death, a 78-year-old male from Mason County. The 5,919th death, an 83-year-old female from Putnam County. The 5,920th death, a 72-year-old female from Jefferson County. The 5,921st death, a 72-year-old male from Putnam County. The 5,922nd death, a 63-year-old male from Upshur County. The 5,923rd death, a 56-year-old male from Fayette County. The 5,924th death, a 92-year-old male from Wood County. The 5,925th death, a 79-year-old female from Nicholas County. The 5,926th death, a 75-year-old female from Kanawha County. Everybody really pay attention to this, and it's really such a shame. The 5,927th death, a 20-year-old male from Kanawha County. The 5,928th death, a 50-year-old female from Calhoun County. The 5,929th death, a 76-year-old male from Wetzel County. The 5,930th death, a 64-year-old male from Wetzel County. The 5,931st death, a 94-year-old female from Monongahela County. The 5,932nd death, a 60-year-old male from Kanawha County. The 5,933rd death is a 70-year-old female from Preston County. The 5,934th death, a 64-year-old male from Wood County. The 5,935th death, an 83-year-old male from Mercer County. The 5,936th death is a 77-year-old male from Barber County. The 5,937th death is an 83-year-old female from Marshall County. The 5,938th death is a 71-year-old male from Mason County. And the 5,939th death in West Virginia is an 87-year-old female from Kanawha County. We've lost so many beautiful and wonderful and great people in this state, and it's a crying shame. Our active cases are down to 8,339. We have 2,266 new positive cases today. Our daily positivity rate is at 14.43. Our cumulative rate is at 8.29. We have a little over 454,000 people that have had this and recovered. We have 906 people in the hospital, 215 in the ICU units, and 112 on ventilators. You know, our red counties still are coming down. You can see there we only really have 3 red counties now. We do have 9 green counties, thank goodness, and surely our map is starting to look better and show us the indication that this surge maybe has very well peaked, and we're surely moving in the right direction. But again, I ask for your prayers for all these great folks. Our National Guard continues to do unbelievable work at 34 facilities. We have 290 people, Guards members that are working there. I remind you about these home kits, free kits, these free testing kits. You can get them now and everything. If you'll go to our COVID-19.gov information line on our website and everything, we can get you that stuff and that information. And you should be able to pick up your N95 mask at the pharmacies. They should have them now and everything. You can get 3 per person there. Most of your antibodies are being discontinued and everything. There are still several different therapies that can help you if you're tested early enough and we catch this early enough to where you can, have a real ability to combat this thing and not get worse. And that's why I remind you over and over, if you're 65 and older and everything, you get any health condition that gives you any level of anxiety and everything, please go get a test. Please go get a test. From the standpoint of wearing your face coverings, over and over, I've told you that if you're 65 and above, and you have any compromised situation, whether it be lung or diabetes or heart situations or overweight or whatever it may be, and you're going into a crowd of people indoors that you don't know and everything, you may want to consider wearing a mask. I would tell you, that it'd be a really good idea to wear an N95 mask. Any mask is probably giving you some level of protection, but the N95 will help you more than anything as far as what we know. I've gone over the booster 17,000 times, and I'm not just going to keep belaboring it, but I really think that if you are fully vaccinated and you're not getting your booster shots, you're making a great big mistake. The numbers are still, slowly but surely getting a little bit better. We're now up to 89.8% of all the 65 and olders and everything, and the others are remaining about constant. All the information on our vaccine info line's up. I remind you about all the free testing. I always thank Fruth and Walgreens for all the great work that they did. We've got 159 outbreaks in our long-term care facilities, 1 outbreak in our church community. As I've said before, it's Nicholas, and we want to get that gone. We have 835 inmate cases at 22 facilities and 191 staff. That's down a little bit. It's an awful big number, but it's down a little bit from where we were. I remind you, if you're a renter or a landlord, to call us and maybe we can get you some extra money, through these struggling times. I remind everybody over and over about giving blood. And I tell you that our Job Jumpstart program that's going to give people a check for $1,500 if they'll get a job and they'll stay on the job for, I think, 8 weeks and or more and get themselves back in to the employment process and everything. And we'll give them a little jump start, in getting them back going and everything, but we need them. We need them back to work. That's all there is to it. But, our unemployment numbers are the lowest in history, but this will just make those numbers even better. So if we can help these folks get back, we'll help our businesses, and that's what I'm trying to do more than anything. Maybe we can change a life in the process here, but our businesses need these people back to work. And I did sign the nuclear power bill yesterday. I sent up a letter with it only to caution us as we go forward. It's great. We can really probably have some new announcements that are right on the cusp and everything, for rare earth or whatever it may be, to where we're going to be able to truly begin to move forward in even a bigger way. There's lots of folks that want to come to West Virginia, and all I do is caution you on just this. As we move forward with this, we want to always err on the safe side, and we absolutely don't want to do something that's going to have someone up and try to take advantage of West Virginia. My letter is only just a shot across all of our bows to really just watch what we're doing. Just watch what we're doing. We're doing great stuff in West Virginia, and West Virginia is that diamond in the rough that everybody's missed. And I'm proud to sign the bill and us move forward. And I thank our legislature for all the great work that they're doing in regard to that and lots of things. So nevertheless, that's all I got right now. Thank you so much.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good morning. In supporting some of the comments the governor has made, it is really clear from a lot of research that is coming out from all over the world, including the United Kingdom, excuse me, and Israel, that a booster dose is critically important when dealing with Omicron as the variant that is spreading in the United States and in West Virginia. And as we look, as the governor mentioned, at the very, I think, clear information, then it's important for people who are watching or listening to look and make sure that you've had 3 doses of the vaccine at this point. And right now, the first 2 doses of Moderna or Pfizer should have been given well within that sort of 5-month window. And 5 months after that last dose of either one of those 2 vaccines, then all people who are eligible in West Virginia should really seek to get that additional dose. And that is called the booster dose. And we know from data from Israel particularly that older people that get infected with Omicron are much better protected from Omicron's severe complications, hospitalizations, or death with that 3rd dose of the vaccine than they are only with the first 2 doses. And that's about 14 times better protected from death and about 17 times better protected from infection. And we see the same thing in the United Kingdom, in that people who get the booster are protected against getting COVID infections and also against the severe complications. Around the world, we also see that many countries are starting to see the end of the Omicron surge. It's getting much less of an issue. In the US, we are seeing our hospitalizations and cases reduce, although the hospitalizations are still greater than we saw during the Delta surge. What is important to recognize, though, is our deaths are still not going down. And in fact, we had about 3,400 deaths yesterday in the United States, which is about 2/3 of the highest day we saw before the vaccines, and still greater than any time that we saw during the Delta surge. And the United States, at the same point in the Omicron surge, is about 80% higher than countries that are more fully vaccinated and boosted. So really, really important to pay attention to that. The FDA just approved for 18-year-olds and over the Moderna vaccine, fully approved. So that makes Moderna the second fully approved vaccine by the FDA. And again, remember, Moderna is for people 18 years old and over. And Johnson & Johnson has decided to stop at this point the production of their vaccine, the one shot. And I think that a lot of what happens next year will depend on, the need that Johnson & Johnson sees. But important information to show that Moderna has all the data to show that it is fully approved by the FDA, safety and effectiveness, but also, as the governor said, that extra dose, the third dose of the vaccine, which is 5 months after the second dose, and we call that the booster dose. That is really, really important in protecting all West Virginians and all Americans from the Omicron variant. And we know that the death rate is starting to go up again. So in our highly vulnerable over 50-year-old West Virginians, and particularly over 65-year-old West Virginians who have still been less than 60% of those eligible who have gotten that booster, that third dose, we really call on all people in that category to go out even today and get your third dose of your vaccine. That will protect you against hospitalization and, importantly, against deaths. And that's really what we're trying to do on both sides of our mission. So thank you so much.
Thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. Update on antibodies. We did see a slight increase this week in the doses being shipped to us. 384 courses of sotrovimab are being delivered today and tomorrow. In addition, we continue to see, while not as many as we have requested, but we still see a steady flow of the antivirals being made available to us in the state of West Virginia. As the governor pointed out, National Guard continues to do great work. 316 guardsmen in 39 facilities. That includes 35 hospitals, 3 long-term care facilities, and 1 community mental health facility. Hospital numbers, as pointed out, continue to trend downward in the right direction, as does our transmission rate value. But as Dr. Marsh pointed out, deaths continue to rise, and you heard the numbers that the governor pointed out. And again, while it is exceptionally unfortunate that a 20-year-old West Virginian lost their life to COVID, we know that it's still the largest majority of the people are over age 50. And as Dr. Marsh pointed out, if you're over age 50 and you have not had 3 shots, you need to be either contacting your health department, your healthcare provider, or a pharmacist and work to determine your status and to get that 3rd shot. The 3rd shot, as we've seen from some national data, 99% less likely to die or 96% less likely to go to the hospital if you've had that 3rd shot, that 3rd dose of the vaccine. Thank you.
All right, thank you, sir. Next, we'll go to Secretary Bill Crouch with the DHHR.
Help 304 is West Virginia's emotional strength line. Crisis counselors are available for stress management and referrals. Help for West Virginia is for substance use disorder and behavioral health issues. The National Suicide Prevention Lifeline help is always available. The Children's Crisis and Referral Line is available for families and youth to talk with crisis specialists in their community to help de-escalate a crisis or find services. These helplines are open 24/7, 365 days a year by phone, text, or online chat. Please do not delay to reach out if you need help or if you need someone to talk to. So again, thank you all for your service. We appreciate it.
All right, thank you, Bill. Dr. Anamjad, our State Health Officer, had a prior engagement, will rejoin us on Friday. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. My question is for Dr. Marsh. Could you give us an update on masking advice for fully vaccinated and boosted individuals? I know we're starting to see states like New York that are easing their indoor masking policy. So I was just wondering, what should fully vaccinated and boosted folks be doing regardless of local recommendations? Thank you.
Dr. Marsh, please.
Thank you, Governor, and thank you, Charles. So I think that it's an important question, and we see more and more in other countries, Denmark being the one that comes to mind, that many of those restrictions are now starting to go away, but they are heavily vaccinated countries. Certainly, as we have said repeatedly, for people who are fully vaccinated and boosted, particularly people that are fully vaccinated and boosted and younger, then making your own decisions about your own risk about wearing masks or not is reasonable. I think that the key is that we also are protecting other people when we wear masks, not just protecting ourselves. For people over 50 years old who are still in our vulnerable category related to the number of hospitalizations and deaths, and looking at our own breakthrough data, particularly related to people who are having breakthrough infections and dying, it really is centered on our older part of our population, people over 50, over 60, and then over 65. So my advice is, if you go into a highly crowded indoor environment, even if you're boosted, even if you're vaccinated and have gotten your third dose, and you're in that vulnerable category, I would still consider wearing a good quality mask for right now. The transmission of the Omicron variant is coming down, but as we've seen, our hospitalization numbers are still higher, certainly, than we saw them at the nadir, before the Delta surge. And we want to continue to be careful because we still anticipate the number of deaths is going to go up over the next few weeks. So I think that, Charles, as we go forward and more people get vaccinated and boosted and Omicron starts to really go down and the hospitalizations and the deaths go down, then certainly I think that's a time for people to continue to reassess, what they want to do to protect themselves related to mask wear.
All right, thank you, Charles. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. I have a question about the Rental Assistance Fund, and it was brought to me by a viewer who I've been exchanging some messages with. I know the governor has been very active in the last several briefings, almost pleading for people to sign up. But from the experience that this woman has had with her son, along with other people they've talked with, she shared with me that it took 2 months for her son to get approved after he applied, after several calls to confirm information from people with whomever the Housing Development Fund has subcontracted this stuff out. She said they seemed to not know what they were doing. The Housing Development Fund also has been working with someone, according to this woman, whose tenant had applied in October and was still waiting on approval. So when you have those anecdotal stories, and of course we know about the money we had to send back to the feds, I think it was $3 million because of the slowness of getting this rental assistance out. I think it's a fair question to ask, what in the world is going on over the Housing Development Fund that they can't get this money out to people in a timely manner? have they explained to you why they've been so slow, or are they just conducting this like it's business as normal? And are you pleased with how it's gone so far, Governor? Thank you.
Kenny, let me handle this question and everything. All I can report to you is I have not heard these issues whatsoever, and but I will investigate and get on it, immediately. This is not to be tolerated on my watch. I expect people to do good work and to facilitate things and move stuff along for the people of the state of West Virginia. And if we're dropping the ball on this and everything, we need to just pick it up. That's all there is to it. So I'll get into it and we'll report back to you. And I'll welcome the question again on Friday. And I'll either have someone on here with me that can explain exactly what's going on, or that these are exceptions, or that we got to do a lot better. Nevertheless, I'll get back to you. Thank you, Kenny.
All right, thanks, Kenny. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, everyone. Question for General Hoyer. I know we're not getting as many antibody treatments as you would like to see. Are there shortages out there? Are there hospitals that are requesting them and we don't have enough for the people that are showing up that need them? Could you give me a read on that, General? Thank you.
General Hoyer, please.
Yes, sir, Governor. So, Paul, bottom line is we run through every dose of sotrovimab that we have in a week and have requests for more. So while we got some level of increase, we still do not have the numbers that we need for the demand for those right now.
All right, thank you, Paul. Next to Mark Curtis with Nexstar Media.
Good morning, everyone. And Paul Mullen's much too modest, but today's his birthday, so everybody wish him a happy birthday. Listen, I've got two questions here, one COVID related and then one legislative related. I really did ask both. First of all, and this is probably for General Hoyer or Dr. Marsh, we got a complaint from a viewer that says the Pfizer antiviral pills that are being distributed through StarMed are widely available in North Carolina, but not available here for people that have mild to moderate symptoms just after their positive diagnosis. So I'm wondering about the availability of the antiviral pills in West Virginia. And Governor, you mentioned the unemployment situation. Yesterday, the state Senate passed two pretty substantial bills that will cut unemployment benefits from anywhere from 26 weeks down to just 12 weeks, depending on the circumstances and the unemployment situation in the state. Can you support that, and will you sign it, and why? And then at the same time, the House is working through its bill to cut the state income tax for everybody by 10%. And I'm wondering if you'll support that. That looks like the final vote's Friday.
Okay.
Governor,
I think, General, you got to go. Yeah, General, please go first. Yeah.
Yes, sir. So Mark, as with the antibodies, particularly the Paxlovid, which is the better of the two antivirals, we still don't get the numbers that we need or that we would request. So there are going to be points in time where people will ask for those, and we may not have them available. We do a lot of work to move doses across the state to try to meet demands where possible. I would have questions as to whether they are quote unquote readily available in any state, because they are short nationally across the country. So maybe somebody found a point in time where there was an availability in North Carolina, but there is not near the demand, the numbers needed for the national demand. And the last I looked, we were somewhere, we moved somewhere between 22nd and 26th out of 66 jurisdictions receiving. So in many cases, we received more than other jurisdictions. Thank you.
And Mark, if I could answer, I'll answer both questions, as best I possibly can. I haven't seen the bills. They haven't brought them right to me yet and everything. I'm very aware of both, but nevertheless, Mark, in regard to people in our workforce and people that are working and everything, I want to encourage them to get back to work. I mean, that's all there is to it. And if these bills basically, encourage people that, we got naturally in any system, in anything that happens, you have some folks that are scamming the system. For the most part, you have the great majority of the people that are hurting or looking for work, can't find work, whatever the situation may be. But nevertheless, if you can't find work in West Virginia today, you must not be looking real hard. And so I would encourage and I would support anything that pushed people to get back into the workforce, because we need them. We need them very badly. And in regard to the income tax stuff, no one's talked to me about anything whatsoever. And we'll see how these things progress and move along. But the parameters we've surely got to meet is we've got to be sure that we don't do anything that basically prohibits us from taking advantage of these federal dollars that are coming to us and all these stimulus packages and everything. But beyond that, Mark, I last year was really I worked really hard to get us on a real pathway to get rid of our state income tax. And I am a real proponent of doing that. But in what I had proposed last year was a mechanism that basically would have put net dollars in everybody's pocket, net additional dollars in every single person's pocket in this state. And we had worked really hard on it. It was a fabulous plan and everything. And I stand ready to discuss any proposal, because getting rid of the state income tax in West Virginia would be an absolute milestone that would drive a lot of folks to West Virginia and make a lot of good things happen for all of us. But nevertheless, we don't want to do anything that's going to disrupt our ARPA money. We don't want to do anything, that's just going to put a Band-Aid on something, so 10 people can get on a soapbox and say, look what we did and everything. And at the end of the day, it didn't accomplish hardly anything. So I'll sure look at it, and my feelings. I'd love to get us on a pathway to getting rid of the state income tax in West Virginia. That's for sure.
All right, thank you, Mark. Governor, I'll turn it back to you.
Okay, let me see. Okay, I just got a note. I just wanted to read the note and everything that 90. And this is back to Kenny. They just gave me a note on this, Kenny. I'm going to follow up and check on this, but the Housing Development Fund has approved 96, according to the numbers that they just gave me, 96% of the applications that they've received, and Kenny, there may very well be a person, or whatever out there that they've missed or fallen through the cracks. We're going to find out. If you could help us with who that person is, we'll get back to them immediately. But nevertheless, like I said, Kenny, I'm not going to have my people. I'm not going to have my people do bad work, and they know it. They absolutely know it. That gets back to the want to be Jimmy and Jim and don't want to be James. And I don't want to be James, and I don't want you to see James. But I will not put up with slack work. That's all there is to it. So nevertheless, if I could just review very quickly, and Kenny, get back to us if you would with that person's name, and we'll get back to them. General Hoyer corrected me, on my notes. I had 290 Guards members that were working, and he said it's 316. I had, 34 facilities. He says it's 39 facilities. I always want to go back and get it right, because really and truly, what these people have done is unbelievable. It's just unbelievable. I mean, from the very get-go, if you had any idea and you had the info that I have of what our National Guard has done and continues to do, gosh, they need to be praised every single day. I mean, what incredible work, and I can never thank them. No way can I thank them enough. General Hoyer also said just this. Goes back to the booster shots. You know, if you're over 50 years old, and you do have your booster shot, you have a 99% chance, 99% better chance of not dying or not being hospitalized is 96% if you've got your booster shot. You got to get your booster shots. And then I think Secretary Crouch made a wonderful point today, you know, in thanking our healthcare people all across the spectrum, all of our emergency responders all across the spectrum for incredible work that they've done. He is exactly right. They have run to the fire over and over and over and over, and absolutely made us all so proud. So thank you to all those folks in every way. And the last thing I've got on my list is happy birthday, Paul. You know, I know you're not getting any older, but happy birthday to you. And I've got one more thing today because I'm not going to be able to bring her on Friday with me. But you know, we got the Super Bowl coming up on Sunday. Baby Dog thinks she's got it figured out right now. You know, last year, you know, she nailed the score, nailed the over and under. You know, had, I think, the Kansas City score exactly right and right on the number and 31 points. But she's going to make her prediction for the Super Bowl right now. And if I can have a little help getting her up here, all right, baby, you sit right there now, okay? All right. And here's what she thinks. She congratulates the LA Rams and the Cincinnati Bengals for getting there because they've beaten some incredible teams. And she says, and here's what she says. She says the LA Rams, and here's her numbers, that's a 2, and this is an 8. LA Rams, 28, and the winner of the Super Bowl is going to be the Cincinnati Bengals, 30. And that's Baby Dogs. That's her prediction right there. Cincinnati Bengals 30, LA Rams 28. Y'all have a wonderful Super Bowl. She won't be able to be here on Friday, or I'd have her here on Friday, but that's her prediction for this year. Cincinnati 30, LA Rams 28. Thank y'all so much. Have a good day, everybody.